Okay, once again, you're all welcome to our lecture, our class for today. And I want to believe we have a reasonable number of students, candidates present, so we can start. Or better still, let's see, hang on for like 2 minutes to see if Mo will join. Because the number is not encouraging as compared to the total number of candidates that makes up this class, this diet.
How do I rename this thing again?
Please, I'm of the opinion that you can go ahead. Don't need to start waiting. 20 is the number.
So that is how it has been since yesterday. So we should continue.
Please, can you go ahead?
Please mute your mics. Kindly mute your mics. Okay, once again, you're all welcome to a lecture this evening. And the course will be taking, course title is Professional Ethics and Accountability. SWPCE 602. This course, as its facilitators, Dr. Atere, Olawale, and my humble self, Mr. Mbina, Atere. So in the course of our engagement, as far as this particular course is concerned, you would either see Dr. Atere or social worker Mbina, Atere. So generally, we'll be talking about professional ethics and accountability. So today, we'll be looking at the concept of social work, the concept of social workers, profession, what makes social work a profession, what is a profession, and who are professionals. So these are the highlights of, this is going to be the highlight of our discussion tonight. And while discussing, I would encourage us to try to see how we can make the class an interactive one. And that's the main reason why materials, the slides were shared ahead of time so that you can go through and prepare for classes. So the same slide you have is what I'm using to facilitate, okay? So going forward, we'll now be looking at who are social workers. But before I proceed, please take note of this simple definition of social work according to Pincus and Manyhands. According to Pincus and Manyhands, social work is defined or is referred to as the professional way of helping people help themselves. That means as social workers, according to these scholars, they believe that what makes one a professional social worker is for this social worker or this professional to have the know-how and the do-how, the technical know-how and the do-how to help people help themselves as we meet them at their point of needs. So it's not just about helping people. You hear people will say, social work is a helping profession. Granted. But it's not just about helping people, but we help people to help themselves. And that is why these scholars went further to point at some objectives that makes up their definition, namely helping individuals by building their coping capacities and their problem-solving abilities. So social workers are geared towards helping people, equipping them with what it takes to identify resources within their environment, their immediate environment, opportunities around them, who by themselves, because of their disabilities or because of their, will I say, disequilibrium, they cannot identify or reach out to these opportunities. So we help them assess these opportunities, oftentimes within their environment, or linking them to opportunities. Because as social workers, we are expected to have a piece. Hello, Kehinde. Kindly mute your mic. Thank you.
Hello.
So as social workers, we are expected to have a broad-based knowledge to help identify individuals' problem and help them cope with their problem. That is what it means to help build their coping capacities, because some problems cannot be taken or some problems cannot be eliminated. So these clients have to live with these problems. And how do we help them in this case? We help them cope with the problems and still find meaning in life, still enjoy life with those problems. And this can only happen when we succeed as social workers to help build their coping capacities. On a further lighter note, social work can be defined as the prognosis and diagnosis of social problems. So we don't just address problems as they present themselves. We don't look at problems or identify problems when it is happening. By virtue of the happenings around us, we could diagnose, we could ascertain, we could explain, we could even peer into the future and say, okay, fine, given to the fact that these things are happening the way they are happening, in the future, this is where we'll find ourselves. What can we do to ameliorate the situation? What can we do to address it so that going forward, we can be better prepared and well positioned to handle these problems when they present itself? That is social work. So if you see yourself identifying problems without the technical know-how to address those problems, then you need to step up your game. Because we are not just about identifying problems, we are also interested in giving support and putting effort, measures in place to address those problems. And not just addressing those problems, going forward, you ensure that the measures on ground or in place are sustainable. Now, who are social workers? Social workers are professionals. Professionals that are trained specifically for the job expected of them as social workers. And in this case, social workers are trained to build partnership among professionals, working within the field of psychosocial interventions, caregivers, and families, collaborating with communities, with the goal of creating supportive and a conducive environment for clients or service users. They are also trained to advocate for adequate services for the clients or service users, treatment models, helping them to access resources, and also drive home policies, as well as change policies that would address issues associated with poverty. So when it comes to policy formulation, social workers are also at the forefront because we are more like grassrooters. We identify problems at the grassroots, drive home policies, or try to inform policies by contacting policymakers, lawmakers at various levels. And once these policies are formulated, are in place, we try to see how we make sure we drive home those policies to reach the target population. And that is what we refer to as policy administration or welfare administration. Because oftentimes, sometimes we have these policies that are not working. They are just there, dormant. But we put life to these policies, we put life to these laws by virtue of administrating or administration policy or welfare administration, driving home these policies to ensure that the purpose for which these policies were formulated are being utilized, and to ensure it reaches the people for which these policies were formulated in the first place. So social work or social work professionals are also interested in addressing issues associated with employment, preventive programs for less privileged people, pushing for housing and social justice, as well as providing support services for the less privileged and the disadvantaged in the society. We'll now be looking at some definitions from international bodies like International Federation of Social Workers and International Association of School of Social Work. These international bodies see social work as the profession that facilitates social change and development. So whichever way you want to see social work, that is why I started my conversation by saying that social work has a very broad base when it comes to knowledge or when it comes to practice. The practice base of social work and the knowledge base of social work is very broad. So whichever way you want to define social work, it is acceptable, but then you must capture the fact that it is a professional way of addressing human needs or trying to ensure a possible society. Because what we do as social workers is what a layman can term as humanity or a philanthropic services. But then the difference between a professional social worker and one who considered himself to be a philanthropist is the fact that while a philanthropist will just go out of his or her own, will I say, benevolence, out of benevolence or out of his own goodwill to provide services to people, social workers or professional social workers ensure that the root cause of those problems are being addressed to prevent reoccurrence. And this calls to mind the saying that instead of teaching people how to, instead of giving people fishes, social workers try to see how people can be educated or taught on how to catch fishes. So another situation is like you going to, maybe you seeing someone that is hungry, and this person is hungry because he or she is poor, and you decide to give the person money. Fine, that is good. But then what happens after that money finishes? Let's say you give the person 100,000. What happens? The person will still slide back to poverty or will still be hungry. But social workers are professionals in their engagement, in that they try to see how environments or changes or social problems that relegates people or place people in this disprivileged position are addressed in itself, in its entirety, to ensure that people come out of that situation and become useful to themselves and to the environment. So the principle of social justice is central to social work, capturing human rights, collective responsibilities, respect for diversities, and engaging in what we refer to as cross-cultural social work or cultural diversity. As we proceed, we'll come to understand how important it is for social workers to be culturally sensitive to as far as their practice is concerned. Social work professionals or social work profession is guided by ethics and accountability. Therefore, the ethical or professional ethics and accountability has to do with the legal responsibility that guides the social workers' engagement in the course of their professional relationship with their clients, to ensure that social workers adhere or professionals adhere to the professional standards, guidelines, methods, modes of operandi as far as the social work profession is concerned. This means that every social worker is expected, every professional is expected to be answerable for his or her action or his decision and responsibilities within the scope of practice. So it's not all about you saying, okay, fine, I am a social worker, and because I am a social worker, I am at liberty to engage in putting effort in place to address social problems without following some laid down principles. If not, you'll be shooting yourself in the leg. And that's what this course is all about, helping to expose us to the professional ethics of social work practice. What should guide us? What we should pay considerations to in the course of our engagement with clients. Going forward, we'll be looking at whenever we make mention of, or whenever I make mention of service users, I'm referring to the clients. That is those that use our services. And whenever I make mention of service providers, just know that I'm referring to the social workers, right? So who are professionals? Now, understanding who professionals are will help us to justify and identify the place of social work, or how social work can be considered to be a profession. One, a profession is a vocation requiring advanced education and training. Among you here, dear candidates, are graduates from social work. Some of you are even pursuing your master's or even PhD in social work. Some of you are in one or two ministries where you've been practicing social work for a very long time. But here you are because you want to be licensed, because you want to advance you want to improve in your service delivery. And that is why, and that's what makes social work a profession. A profession is a job that requires specific training and is regulated by certain standards. That is why oftentimes you hear people will say, okay, fine, among the medical professionals, you hear them say, okay, these people are quacks. That is because the persons or the group of persons considered to be quack are people who lack the specific training and who are not regulated by a certain standards that govern those that have the required training, those that are considered to be professionals. So in social work, we are also considered professionals because we are exposed to specific training and we are regulated by some standards. We have some principles, ethics, as well as code and mode of operandi that governs the profession. So you cannot just jump and say, okay, fine, I'm a social worker. Let me just do what I like. No. For example, for the first time since 2000 since the inception of social work in Nigeria, for the first time around 2002, we had a law backing the social work profession in Nigeria, where the Chartered Institute of Social Work Act, and we now have an act to backing the Council of Social Work of Nigeria. Although the council is yet to be instituted, right? But the C-ISOWN, with its mandate, started with the responsibility of training and licensing professionals, of which that's the reason why most of you are here. So that makes it a profession. Thirdly, according to Roscoe, he defined a profession as a group pursuing a learned act or a common calling in the spirit of public services. Yes, we all are interested in one aspect of social work or the other. But in the end, we all have one goal, that of giving answer to the husband question, which asks, how can the society be possible? Whether you find yourself in medical social work, psychiatric social work, social welfare, social work, or school social work, and lots more. The interest and the objective is to ensure that we make the society a possible one, where everyone can have access to services and everyone can contribute to become useful to his or herself and the society at large. So we can now see from all angles that social work is a profession, not just by words of mouth, but in practice. Having known this, what is expected of you as professionals? Who are professionals? Professionals are experts with expert power. You know, when one is considered to be an expert, in fact, the fact that you're considered to be an expert automatically means you have some relative power over those that lack the knowledge and the training of that particular profession that makes you an expert. So when it comes to helping people, when it comes to rendering professional services, helping people as we meet them at their point of needs, equipping them with the technical know-how and do-how to become useful to themselves, bringing them back to their mainstream of social functioning, makes them an expert with a relative power. Yes, that brings to the fore the importance of empowerment in social work. What you do in your engagement with clients oftentimes, in the end, is to empower them. And how do you empower them? For example, you meet someone that is depressed, you help them get back to their footing, you link them to resources, refer them to areas where they can be attended to, and gradually you see them manning up, you see them taking charge of their problems and coping with their situation. They're able to do this because they've been empowered. And you've succeeded as a professional to make judicious use of your expert power to empower them to come back to their mainstream of social function. So this means that as social workers, as professionals, you're expected to use your power to influence your clients positively, not in a negative way. Yes, of course, powers can be abused. As social workers, we have a lot of powers. And if care is not taken, you'll be using your powers negatively. So as we proceed, that's one of the things we will explore, how social workers are expected to use their powers in a responsible way. Now, professionals are also expected to harmonize knowledge and wisdom. What is knowledge? Knowledge can just be referred or simply be referred to as what you know, theoretical based.
Okay. This thing is working now. The router is working. Is it not? What's this? I knew it was one insect that I noticed flying.
Hello.
Hello,
Sorry,
sir.
sorry for that break. I hope I can be heard.
Yes.
Yes.
Let's kindly mute ourselves. Thank you. So we're talking about harmonizing knowledge and wisdom, right? So as social workers, professional social workers are well trained in the act of helping, in the act of rendering services. And this oftentimes takes place within the four walls of the classroom. And that is why part of the social curriculum. Hello, Eno Edits, kindly mute your mic. Thank you. So the social work curriculum is designed in a way that part of your training or part of their training, their students are expected to be engaged in the field in form of field work. And that practical experience you have, that opportunity you have to apply the knowledge you've gathered so far is what is referred to as wisdom. Hello, Eno Edet. Can you mute your mic, please? Your background is distracting me. Thank you.
200.
Oh, God.
Can you imagine?
Okay, I think she's been muted. All right. So another identifying mark of professionals is correctness. Yes, you can only be correct, or you can strive to be correct at all times as a professional when you're intentional and deliberate. That means your actions are predetermined. Your choices, your decisions are not spontaneous. They are based. That is why social work is scientific. It is not an art. So it's not all about how you feel, what you think, or it's not all about your religion or your culture, but based on situations and circumstances that can be measured scientifically. That makes the professional correct. So as a professional, you must strive to be correct. That makes you a professional social worker. You should also know that as professionals, you are expected to deliver results. Oftentimes people feel that when you engage in activities and you're asked to present results is a way of questioning what you're doing. No. What makes one a professional is the ability to deliver results, professional results. And mind you, one thing about social work is that the services you render today can be visited in years to come. So there is need for you to measure and keep track record of your results. And there are situations that we can present, multiple situations that we can present to justify why it's good to deliver results and to present professional results, right? One is to help you measure progress, right? Because oftentimes your clients might depend on you, on your services forever, or for as long as he or she lives. So how can you measure your progress without keeping track record of the results? Another mark of a professional is culture of performance, development, and reform. Yes, you cannot continue to do the same thing over and over again. Yes, the fact that you were able to do something, or they gave you a task and you accomplish it within the allotted time today, does not mean tomorrow, when given the same task, you should still do it the same way. Fine. Yesterday you did it well. You are expected to up your game tomorrow, even without being told. For example, if you were able to do it within 1 hour, can you try to deliver within 50 minutes tomorrow? What about next tomorrow? Can you try to deliver within 40 minutes? What about next week? Can you try to deliver within 30 minutes? Apart from the time frame, can you develop a better pattern? Can you reform or modernize your method of intervention that will be in tandem or in line with the contemporary society, the realities of today? That's the difference between being efficient and effective. So as social workers, we want to pursue efficiency and thrive to also be effective. Professional networking capacity, as well as knowledge synergy, is also an identifying mark of a professional social worker. What does it mean to be able to practice what we refer to as professional network? Please, just take this nugget. Some of us, I used to tell my students, and I also tell myself oftentimes, one of the professions or one of the beauty of social work profession is the fact that we don't have a separate laboratory where we go to do our work. So your room, your office, your environment is your laboratory. So you say you're a social worker, it should be seen in your attitude, in your character, how you handle responsibility, how you handle your network. You see, oftentimes people that come to you for assistance, you might not even have solutions to their problem directly. You might not even have the capacity to solve their problems directly. All you need to do is to identify professionals that can address that problem. And you cannot just refer them to those professionals and abandon your clients there. No, that is unprofessional. So what it entails is, at the center of it all, the social work, the client is at the center. While the social work professional is expected to network, link that client to various professionals that will revolve around that client, rendering services to that client, while you, the professional, would be playing the supervisory role to ensure that these professionals you've introduced or you've referred this client to will not be taking advantage of that client, will not be abusing that client, will not be relating with that client in a way that is not befitting for humans. So you must be able to have that ability, that capacity to network, to identify professionals. That makes you a professional. That is why most times you go to the hospital and the medical doctor, maybe you visit a gynecologist, and after addressing the issue associated with his area of expertise, the same doctor would refer you to another doctor who is more professional in the area that where he is not specializing, right? And in most times, you also see the medical doctor referring you probably to a counselor, referring you to probably to a pharmacist, referring you to the nurse and the rest. So that is the professional network we are talking about. So as social workers, oftentimes, you might see yourself referring a client to another social worker. That is not a sign of incompetence. Rather, it's a sign of you being competent and professional. Going forward, we'll now be looking at professional ethics. You see that wherever there are professionals, there must be some ethical code guiding them, their practice, their engagement, defining the work they do, and detecting how they should go about their work. Before we proceed, I would like us to, earlier on, I said I would want this class to be interactive. I've been talking for the past 30 minutes. So I want us to have an input, probably from our experiences, or possibly ask questions, please. So you can unmute yourself and, or better still, you can indicate by raising your hand. You can use the icon there to indicate you want to talk, if you want to talk, so that I can point you, I can unmute you to speak. Please ask questions. Feel free to ask questions or make an input. I hope I can be heard.
Yes, sir,
Hello?
we can hear you.
Okay.
Hello.
Yes.
Okay.
Adebi, please.
Yes, I want to ask a question.
Please
You
ask.
talk of people that can be referred to as social worker. Then you are saying some people might have gotten their certificates. It might even be a related field, but those people did not practicalize it. Then you say they can be trained. The training that such people will get, will it be so substantive as retrained social worker in the 4 walls of the school?
Please, let me get you
Hello?
clearly. Let me get
Sir?
you clearly. Yeah, let me hear you. Let me understand you, please. Can you repeat your?
Okay, you said people that can be referred to as social worker. You said what are you prepared to be called as a social worker?
Yes.
You said social workers. You say you mentioned that even some social workers, some people that want to become social worker. Hello?
Yeah, I can hear you. Please go on.
You said part of it that some of them can be trained. That they can be trained as social worker. Does it mean people from other discipline, they want to become social worker? You said they can be trained. Despite the fact they've gotten their degrees in other fields, but they want to become social workers. You're telling us now that they can be trained. In what way can they be trained to make them really sustainable social worker in practice?
Okay. Yeah. Let me see if I really understand your question.
Yes, sir.
You know, like you said, like I rightly said earlier,
Yes, sir.
before you can be considered to be a social worker, you must
Yes,
pass
sir.
through training,
School.
right?
Yes.
So even those who have BSc, MSc, and even PhD in social work, right?
Yes.
They have that background, academic background. Now, for them to practice, they must go through the process of retraining and be licensed. I don't know if you get the point.
Okay, you are telling me that those people that have the background, in social work. What about those that are not, the discipline is not even related at all?
Yes, that's why oftentimes most of them will be subjected to a further training. What background are you coming from? Let me use your background for example.
Well, I'm a social worker, but I've not been practicing as a social worker. I've not been practicing. Right now, I'm a lecturer in a university. I've not been practicing. I've just been lecturing in a field that is, but I've been using the social work background to do the lecture or to carry out the lecture.
Okay. Beautiful. Now, this is the point, right? And I'm happy you're coming from an academic background. Now, the thing is, most persons who form this class, right? Apart from the academic background, most persons have been exposed to social work practice for a very long time.
Okay.
So those experiences count. I don't know if you get the point.
Yeah, I'm hearing you, sir.
Yeah. Most of them have been exposed to social work practice for a very long time. Those experiences count. And that's why most of them were placed in, will I say, a kind of PGD program that ushered them to this level. It's just like maybe someone that studied sociology wants to study social work. This person will be that student. So we also have a PhD package. Most of the students here are either, most of the candidates here are either who don't have social work background, are either PhD students in social work or graduates from social work departments.
Okay.
Who are
but
also
they didn't actually study social work.
You mean?
I said, but they did not study the social work entirely. They have their background related.
Yes. They have their background related. And most of them were asked or were admitted to do a PGD program. So if someone is coming from a PGD background, the person is also trained, coupled with the person's experience, right?
It's true.
Coupled with the person's experience. Most of them are from the ministries and they've been doing social work, although without knowing the, will I say, the professional way of handling.
They're learning on the job. They are learning on the job.
Exactly, they're learning on the job. So for them to be licensed and recognized, they have to come back for this retraining.
Okay.
Does that answer your question?
Yes, it does. Thank you so much.
All right. Okay, let's proceed. Professional ethics. Like I said earlier, when we talk about professional ethics, or whenever you hear profession or professionals, what should come top of your mind is the fact that these are a group of persons trained or with a specific training in a particular area of specialty and are guided by some set of principles. Now, the social work profession is not an exception. But then, before we go deep into social work professional ethics, let us consider what professional ethics is all about. Like we said earlier, that profession is a vocation founded upon specialized high educational training with the purpose of rendering services to others. Professional ethics has to do with the personal or corporate standards of behavior expected of professionals. So in social work, we work with people. We work directly with people. We work with clients. Oftentimes, these clients are depressed. They lack the ability to make decisions or choices for themselves. They are weak. And we see ourselves relating with them. Hence, the need to be guided by professional ethics to maintain boundaries so as not to take advantage of our clients. To maintain boundaries so that our clients will not also take advantage of us. To maintain boundaries so that the purpose for that professional relationship will be achieved. So professional ethics is concerned with one's behavior and conduct when carrying out professional work. And this professional ethics cut across different cultures, right? So professional ethics also points to ethical norms, values, principles that guides the profession. Both in practice, directly, or in ethical decision-making within the profession. So when we talk about ethics, you should also know that ethics or ethical norm has to do with right or wrong. So that means if you're expected to do something a particular way and you decide to do it contrary, you will be made to face the consequences. So in practice, as professionals, we should know that our actions comes with consequences. So having these at the top of our mind will help us to subject ourselves to the professional code that governs the practice or the profession. Professional ethics consequences are based on ethics outcome. Character principles are based on ethic rules, codes, and standards. So these should be at the tip of our fingers. So what are the basic principles and components of ethics? Let us now look at those principles that makes up ethics, right? One of those principles or basic components of ethics is what we refer to as the utility principle. The utility principle. Now, when you talk about utility principle, it has to do with usage. In social work, we leverage on, or we take advantage of a lot of principles, a lot of facilities, a lot of skills, theories to drive home services. Now, you must understand how to navigate through these principles, through these facilities. And you must know how it works. Rights principle. Yes. The fact that people come to you or clients come to you for services does not mean their rights should be trampled upon. In fact, one of the core values of social work is to recognize the rights or to pursue the rights of people, the disadvantaged, the less privileged in the society. That is social justice. The fairness principle and components of the ethical code of social work in social work has to do with impartiality and neutrality. So the fact that you're being fair is not enough. Are you fair and impartial? Are you neutral in your decision? There are situations where we can be fair in our judgment, but we are not neutral. There are situations where we can be impartial, or we can be partial in our decision without knowing. So oftentimes in practice, we need to ask ourselves, what I'm doing, am I being neutral? Am I being fair? Because like I said, one good thing about social work is it is scientific, and it's expected that your engagement with a particular client using the same method, if another social worker should use the same method to engage that same client, you should have the same result. What about social justice principle that has to do with equity? So even when you're pushing for justice, social justice, are your efforts, are your engagements equitable? Another principle or component of ethics is professional competency. Yes, as a professional, it is ethical or unethical not to be competent in practice. Just like the candidates that asked question earlier talked about social workers that, or some persons that have been trained in social work, that have the background in social work, and they want to stand up to say, okay, fine, I'm a social worker. That is unethical. It's unprofessional. Now, for you to be considered a social worker, you must be trained. You must be licensed. So until you're licensed and you keep engaging yourself in progressive training, you must be consistent and deliberate in your efforts to improve. And these are things you need to tell yourself. You need to work on yourself to see how you can improve in service delivery. It is part or a component of that makes up the basic principles of ethics in social work. You must also be efficient. The efficiency principle. Earlier on, we talked about the fact that you're given a task today and you're able to accomplish within record time. Okay, fine. You were asked to finish that task within 30, let's say 1 hour, 30 minutes, and you were able to achieve that task in less than 1 hour, 30 minutes. It's not a justifiable reason to do the same tomorrow. Probably, granted, nobody might question you tomorrow, but within yourself, you must be able to measure. You must be able to ask yourself. You must be able to convince yourself that, yes, you're keeping tabs, you're making improvement, you're efficient in practice by not just saying, okay, fine, after all, I'm still doing it within 30 minutes. What about accountability principle? Whatever you do, you must be accountable. In fact, as a core value in social work, it is expected that social workers practice in a way that will make them accountable to those they are rendering services to. What is accountability? You must be able to build trust. It's not just about rendering services the right way. Are people, are your service users comfortable with the way you're relating with them? Do they trust you? Are you transparent? Are you respectful? All these are part of the components that makes up the ethics, the basic principles, components of social work ethics. Another thing is the obedience to the law. Yes, whatever you do, the laws of the land is a grand norm. You must subject your engagements, your practice within the expounded laws of the land. The fact that you're a social worker and your knowledge base is broad does not make you bigger than the law. Or the fact that we have a principle of non-judgmental attitude or a principle of client self-determination does not mean we should encourage or allow our clients to do things that are against the law. If you should engage in such practice, you'll be going against the ethics or the principle or the components of the ethics of social work that has to do with obedience to the law. As we proceed, we will come to identify what it means to practice within the ethics that has to do with obedience to the law. What's the meaning of code of ethics? The code of ethics is a statement which expresses primary ethical values, obligations, and goals of profession. So that document or that set of instruction, those statements that explains the goal of social work profession, the value of social work profession, the obligations as well as the objectives of social work is what is referred to as the code of ethics. So you're expected to adhere to this code of ethics. At the end of this training or this engagement, you will be qualified. After being examined, you'll be qualified to be inducted and be licensed. As one of the rituals for that engagement or for that induction, you'll be expected to take an oath. An oath of allegiance. So that means you'll be taking an oath, swearing that you abide by the code of ethics of social work, which means that you will practice based on the stipulation of that social work code of ethics. Furthermore, the code of ethics has to do with commitment that serves to bear witness to our promise as professionals to uphold the values and obligation expressed in that code. It gives definition to our commitment to practice in ethical terms. Code of ethics also set out clearly the profession's values and also explain what they are in terms of what we ought to do in order to protect and promote the public good, and what we must avoid in order to prevent harm to the public. So at every time in your engagement with clients, in the course of your professional relationship, you are expected to protect and promote public good. That is how we maintain and continue to uphold the profession's image, not to further harm people or expose our clients to further harm. On the contrary, we put effort in place to protect our clients from dangers. So the code of ethics stipulates that we must practice within these expounded boundaries, ensuring that we do not expose our clients or even be the problems to our clients ourselves. After our clients coming to us for assistance, we'll now be the ones to be a problem to our clients. No. So social workers' ethical behavior should result from their personal commitment to engage in ethical practice. So you must have that interest to be committed to helping people. Please, you please, Olufunke and Sambi Frank, kindly mute your mic. If you're just coming, just mute your mic. Your background can be distracting. Now, why is there need for ethical behavior in social work? Can social workers just practice without ethical behavior? On the contrary, no, it is not possible. Because if we go ahead to practice without the code of ethics, the purpose for our engagement will be defeated. It won't be possible for us to keep our biases in check if we should practice without being protected or guided by these laid down principles, right? One of the reasons why there's need for ethical behavior in social work is because social work is a problem-solving profession. Yes, social workers solve problems, and the problems we solve are problems that are common to humans. We, as social workers, are humans too. We are not immune to those problems. Those problems can also harm us or can also, in a way, be transferred to us. And in social work, we refer to it as vicarious trauma or compassionate fatigue. is situations where client's problem is telling on you. And you know, one of the things we use in practice to connect with our clients, to help us understand our clients, to see the position our clients are coming or they find themselves, to be able to render services to our client is empathy. So in most cases, if you're not careful, you'll be so empathetic to the point that your client's problem will be telling on you. Your client exposing you to secondary traumatic events or traumatic pictures by virtue of their primary exposure to those problems might affect you negatively. So there is need for ethical behaviors to keep us in check, not to be clouded by our client's problem. Social workers come across complex and varied situations that, if not properly checked, we can be taken unawares by our emotions. So there is need for this ethical behavior to keep our excesses or to keep our biases or emotions in check, to be able to handle the situations. To know, okay, fine, this problem is getting out of hand. Where can I refer this client to? Ethics help professionals to act morally in difficult situations. You know, last week I was engaging a friend, and we were having an argument on a particular issue we're discussing. And to my greatest dismay, my friend said, yes, the decision, because we're talking about a particular decision, and before you know it, my friend was saying that the decision was in itself not right, but politically it is right. So you see that sometimes we find ourselves in situations where our hands, as professionals, our hands are tied. And if care is not taken, we'll be making wrong decisions that would even harm us. Remember, earlier on we said something, that as social workers, we need to act professionally at all given time because our actions comes with consequences. So if you begin to behave or engage your clients in an unethical behavior or in an unethical way, it comes with a consequence. And when the consequences come knocking at your door, you should be ready to answer. So there is need for social workers to be guided by ethical behavior, because social workers, during their interaction with clients and significant others, are exposed to sensitive information. Yes, the information people will tell you that if you're not careful and you're not careful, you might not handle it well. So you need to be guided by ethics to know how to manage that information properly. Social workers are also often in situations where their decisions can cause serious damage to clients. For example, with all due respect to people who find themselves in this situation, but we can't help it, let's use the situation to set an example. Let's assume you're a social worker and you're a divorcee. And you have this client that comes to you with a similar problem. And you begin to say, na so men, you know, that was how my husband started, or that was how my wife started. And I didn't notice. I didn't notice on time. That's what led to our separation. That's what led to our divorce. So that is you talking from the points of emotion. Indirectly deciding or making decisions for your clients, which is unethical. So there is need for social workers to be guided by ethical behaviors because of the situations we sometimes find ourselves, which might make us to make decisions that will be damaging to our clients. And remember, as a responsibility, we are expected to protect our clients from further harm. So it would be totally wrong for us to be the ones who are supposed to protect our clients, to be exposing our clients to further harm. So social workers occupy positions of authority in governmental and non-governmental organizations, and by so doing, we have relative powers. So without ethics, we might be taking undue advantage of our clients. Because of the relative powers we have, we might be taking advantage of our clients, abusing the powers we have. Instead of empowering our clients, we might go a long way to further disempower them. And let me also shock us. Powers can be transferred. There are situations where you can over-empower your clients to the point of you being powerless. I can explain. But before I go further, it is good for social workers to be guided by ethical principles to avoid finding themselves in a situation where they can become powerless as a result of over-empowering their clients. Because powers can be transferred. Now, how can this happen? Let's say you have this, maybe you're a very emotional person, and you have this client that comes to you, and the client is relating a very emotional situation that he or she finds himself, right? And before you know it, your emotion is taking a greater toll of you, on you. And your client is now the one trying to comfort you. Because it's obvious from your countenance, it's obvious from the energy you're now giving your client that you're no longer strong enough to handle the therapeutic situation or relationship. So if you find yourself where you become so emotional to the point where your client even notices, you know, there's this energy we give to our clients in the course of our engagement with our clients. And if that energy is not there, our clients feels it. They understand and they know that, this thing I'm telling my social worker is affecting my social worker. That means if my social worker should be in my situation, that means the social worker will just die. Then you can imagine that social worker, someone that is expected to depend on you for assistance. That social worker, that client might no longer come or might not even take you seriously. So we need ethics to keep our emotions in check. Social workers are often in positions where they are called upon to allocate resources. Yes, you might be in a situation where you'll be asked to allocate resources, maybe in your community or in your state. And if you're not professional, you begin to see how you gather those resources for your people alone. And that would be against the principle of fairness and social justice. Because you that is supposed to push for equitable distribution of goods and services, you will now be prioritizing your people. We now see why it is good for social workers to be guided by ethics. And we also need ethics to enable us preserve the professional autonomy. Yes, the social work profession is like the last hope for mankind. And it has taken a lot of professional expertise, sacrifice over the years to build a structure, to build the professional image. All what is expected of us as professionals is to uphold that image and contribute in building that image. So whatever engagement, whatever practices that would dampen the image of the profession or taint that image should be avoided. Hence, the need to practice or be guided by social work ethics. Now, what purpose does this code of ethics seeks to achieve? The National Association of Social Work Code of Ethics serves the following 6 purposes. 1, to identify the core values on which social work mission is based. Now, this entails that whatever engagement you have with your clients, for it to be justified that yes, that relationship is a social work relationship, then it must be based on the core values of social work. As we proceed, we will come to identify the 6 core values of social work and how social workers can tailor in their engagements in line with these core values. So you cannot be saying you're doing social work when you see yourself practicing outside these core values. For example, no matter how well your intentions are, if your effort are not geared towards the goal and objectives of social work practice that are anchored on these 6 values of social work, then you're not practicing social work. So take that to heart. Second purpose of social work or ethics in social work, according to National Association of Social Work, is that the code summarizes broad ethical principles that reflect the profession's core values, as well as establishes a set of specific ethical standards that should guide social work practice. 3, the code is designed to help social workers identify relevant considerations when professional obligations conflicts or ethical uncertainties arises. Yes, there are situations where we refer to as ethical dilemma, where the social workers is caught between the deep blue sea and the dark. You're faced with 2 right opinions or decisions that are correct, but with adverse circumstances, implications. The social worker need to settle for one choice, but then the code is designed to help the social worker identify the best choice to settle for with least harm. Ethical dilemma is referred to a situation where social workers are faced with 2 difficult situations to make. Your hands are tied. You're faced with 2, and you must choose one. You must help the client to settle for one. So no matter how good and appealing these choices can be, they come with implications, both negative and positive. So the social worker or the code of ethics is designed to help the social worker filter this decision and help the client to settle for the one that has the least repairable harm. Social work code of ethics also provide ethical standards for which the public can hold the social work profession accountable. Like I said earlier, social work profession is like the last hope for mankind. We are there at the grassroots, relating with people, identifying their problems, trying to tailor interventions in line with people or to meet people's peculiar needs. People trust us so much. So you must be able to practice in a way that will be accountable. People can always make reference to say, okay, fine, we can trust social workers or we can trust social work. So going forward, you have that responsibility, you have the rule to uphold the professional image as far as social work practice is concerned. By the time you're inducted, and this can be achieved in the way you engage your client or in the way you practice. The code socializes practitioners new to the field of social work on the values, the principles, the ethics, and standards of social work practice. The codes also articulate standards that the social work professional itself can use to assess whether social workers have engaged in unethical conduct. So apart from guiding our engagements, the code of ethics is also that document the professional or the profession use to assess professionals. For example, if you want to investigate to know if a particular social worker has engaged in an unethical conduct, it is the code of ethics of social work that will be used to make that investigation. What principles did the social worker leverage on to settle for a particular choice or decision? Why did the social worker decide to settle for this choice when there were other choices before the social worker? The code of ethics will help those saddled with the responsibility of investigating that unethical conduct to achieve success, to record success, to know if the client made decisions out of his or her own inclinations without leveraging or depending on the principles of social work. So at every given time, please avoid rendering services based on your emotions or based on what you think up there. Follow lay down principles so that by tomorrow, when you're being assessed and measured, your engagement can come out with a positive result. I would also give us room to ask questions before we proceed to values and ethical principles of social work. Please, the floor is open. If you have any question, kindly indicate or unmute yourself and speak.
Hello, sir.
Okay, additional, right?
Yes, sir. Well done, sir.
Thank you.
Please, sir, I want to know, because since you have been lecturing, you are making mention of citations of National Association of Social Workers. Now, the point is, do NASO have the right or the approval to give license to social workers? That's the first question. Then, is there any, how do I put it? Is there any collaboration between NASO and C-ISOWN in giving license to people when you are talking about professionalism now? Because we have a lot of them at my workplace that don't even have the license. I can only pick just 2 people that have the license of C-ISOWN. And we all have the certification of NASO. So I'm getting confused because as you are lecturing, you are mentioning NASO citations in all your lectures, sir. So that is my question, sir.
Okay. Thank you for that's nice question. And I want to believe other persons are also bothered by the question, the observations. But then there's something we are missing. You know, when a baby is growing or learning how to walk, the baby will pass through a lot of stages. Sometimes the baby will even fall. It's part of the process, right? So in Nigeria, the social work profession is a growing profession. It's still trying to get its footing in Nigeria. And a lot of persons are struggling to get a centered stage to be recognized. And in the process, we are making a lot of mistakes. But gradually, we will get there. And the beautiful part of it is a lot of persons are coming to identify with the truth and the realities. The thing is, we must be smart enough to identify where we belong and what stands for what. For example, we have medical association or association of medical doctors in Nigeria. That is just an association. Just like NASO is an association. It's not a licensing body. I am a member of NASO. But the C-ISOWN, Chartered Institute of Social Work, there is an act, and I believe in the wisdom of the organizers of this program, I think among the materials sent to you, that the acts that established the C-ISOWN was also sent to you. You can create time to go through it. An act, C-ISOWN is backed by the law to train and license social workers in Nigeria, although we also have an act that established the Council of Social Work of Nigeria, just like we have the Medical Council. And the Association of Medical Doctors in Nigeria is not bigger than the Council or the Medical Council of Nigeria. It is not. The Medical Council is saddled with the responsibility of overseeing those that are trained and those that are inducted. While the association is also there to ensure that the welfare of these professionals or these these professionals are not trampled, and their rights are not trampled upon. Whenever there is an abnormality, it is always the position of the association to raise alarm, to whistleblow. So association should take charge of the position for which they have powers to take charge, while the C-ISOWN should also take charge of what the responsibilities they've been given to take charge of, which is to train and to license. But the council that is yet to be instituted is saddled with the responsibility of regulating and overseeing the entire activities of social work in Nigeria. And the members that makes up this council, according to the act that establishes the council, will be drawn from various associations of social work, namely SWPCE, NASO, C-ISOWN, and lots more, because we also have like some of us who are lecturers, we also have the ones we are part of, which is Association of Social Work Educators, those who are lecturers, social work lecturers in Nigeria. I am also made part of them. So these are associations.
So, thank you, sir.
So
sir,
if you're asked, for example, now, if I approach an organization for a job and they are asking me for my license, I cannot present NASO certificate as a license.
Sir, that is the issue. That is the issue. A lot of us applied for a job overseas and we produced the NASO certificate and they rejected us. They said we don't have a license, that NASO is not a license.
That is what most persons are yet to come to terms with. And like I will say, I would like to use this medium. I am appealing because definitely if social work grows, all of us will enjoy. But if we continue to fight the way we are fighting, we are bringing down the profession. We should know where there is no way we can continue this way, and yet people would, okay, for example, let's say International Federation of Social Work and other international bodies, social work bodies, have not identified or come to identify with us here in Nigeria because we are still shaking. We are yet to have a strong footing here in Nigeria. But my happiness is a lot of persons are coming, a lot of persons are beginning to identify the importance. In fact, most of you, on this platform personally reached out to me, and they were telling me, I went to social place and I was asked to bring social work license. Beautiful. So that is where we are. We are gradually identifying or coming to terms with realities. So there's no way you would say, okay, for example, let's not even go far. Let's not even go far. Accountants, they have their body as an association of accountants in Nigeria.
Yes.
But that association is not a licensing body.
Mm.
You cannot say, okay, fine, because you belong to that association, then you should be considered as someone that has ICANN satisfied. So while the opportunity to be a member of an association is limited, especially by the laws of our land, you can decide to be a member of any association or not. So you can even be a social worker without being a member of any of the association. For example, apart from NASO, we have SWPCE, Association of Medical Social Workers of Nigeria. They are there. They are also very active. So because I am a medical field, I can decide to be a member of SWPCE without necessarily be a member of NASO, right? But you cannot be a social worker without being licensed.
Mm.
You cannot be licensed, a licensed social worker without being licensed by the body, saddled the responsibility to do that. And until it is changed, we have C-ISOWN. Mark my word, until it is changed, we have C-ISOWN. And of course, there is a law backing that, an act backing that. I can see the hand of Angel Babe. Please unmute yourself and speak.
Mm.
Meanwhile, additional, I want to believe that addresses your question.
Yes, it addresses it, but there should be awareness. C-ISOWN is not creating the awareness. For, like me, from my own state, I finished in one university here in Ibadan, but most people did not even know about this. There should be creation of an awareness for this, sir.
The thing is, if you check, when years back, I was also on this platform receiving training like you. Understand? I can remember those days were very few. So if you compare those days to now, what is happening now, there is an improvement. The awareness is, though it might not be the way we expected, but at least the awareness is there. We cannot doubt that. We are making progress, right? And people will definitely come to terms. People will definitely, and now that you've gotten the awareness, you've gotten the training, it now depends on you to also go back there and let others know. Not because we are looking for disciples. You know, I always try to address the idea that maybe some persons will say, okay, fine, they are looking for members. No. But because we want to do the right thing. You can imagine someone say he's a social worker and there's nothing you can hold him or her on. Okay, for example now, after this engagement, additional, God's willing, you'll be licensed. And once you're licensed, you now engage in an unethical conduct. Your license will be withdrawn. So you have something at stake. You have something to lose. So by so doing, that awareness alone will force you to want to practice within the expanded boundaries of the ethics of the profession. So gradually, we are beginning to come to terms with the realities on ground that yes, as a social worker, there is need for us to be licensed for you to practice. So if you're part of that system, that structure that should carry out that awareness. For example, now, if you, after being licensed, if you have a case and you want to refer a matter to another social worker, you should be careful of the social worker you refer to. Because the same principle that is binding on you is the same principles that binds another social worker. And what makes that social worker to be recognized? Is that social worker licensed? As we proceed, we will come to understand the core values and the ethics of the profession. One of the core values or the principles of social work is confidentiality. That means that if your client tells you anything, you are not expected to tell any other person. But then, as a fellow social worker that is licensed, you can feel free to tell me, because I can be in the process, or I can be of assistance to render services to that same client. Or the both of us can render services to that client. So the same principle of confidentiality that binds you also binds me. So you won't be scared to share the same information with me, so that together we can help that client. But imagine I don't have a license and you're now telling me. So if that client should sue you for confidentiality breach, you will be liable. Because in the court of appeal, court of competence, in the court of competent jurisdiction, the question will now be, who did you share the information with? If you say it's a social worker, can that person you share the information with present his or certificate or license to justify the fact that he's a social worker? You now see where the problem is. We don't have, the problem is in Nigeria, oftentimes we just practice without considering the laws that makes up our rules of engagement. So that, like you say, that awareness need to be created, granted, but we are parts of that system, that structure that should create that awareness. And that is why you're being trained. I can see the hand of, that addresses your question, right?
Yes, sir. Thank you, sir. Thank you.
I can see the hand of Azagba.
Azagba. God bless you, sir. And God bless you, ma. I was trying to reach out to her, but she didn't see my message. So I'm happy to be here. I did social work at diploma first, and I enjoyed the diploma in Unilag. I had to continue on that course, but then it didn't continue. They didn't have it in Unilag that time. So I had to go and do another program in Uniben. So I love it. And I'm in NASO also. And I'm happy to be here, because you do know that as you're in that body, you cannot be licensed to do some things. Because also I had a time I had a program. I wanted to go out the country for a program, and I couldn't go. They said I don't have a license also. So I understand what she's saying. So we're happy to be here. But we also that are here, getting from this training, we can also get that awareness. Because even the last, I think earlier today, I was asked to share something. So I shared something that happened with me, and I played this the video, because normally some recordings they remove some things we share. So I share some things on the platform about a case I handled, So as a professional, we meant to know the cases which we should share and how we share it. I also do broadcasts, So I also sometimes learn from my clients and tweak it a bit, not saying the same way it is, just to create awareness in that area. So being on this platform, I'm learning new things that I need to be very careful how I handle cases. Thank you, sir. Thank you for everything.
Thank you immensely for that that input. And before I forget, this platform is a deliberate one. So feel free to network. You see, it's even a beautiful thing that we are doing social work at this time in Nigeria. The ground or the field is very ripe and is fertile. Whatever you want to achieve. In fact, if we are able to institutionalize it here in Nigeria, and we are able to ensure that only those who are licensed practice, then we would succeed in taking back our jobs to ourselves. A lot of I do a lot of engagement with nurses, medical doctors, and other medical professionals in the health sector and with the NGO. And I notice a lot of what we do, or a lot of our responsibilities, is what they are taking on. And let me shock us. The reason is because, not like all these international organizations that engage these medical professionals, knows that social work is still shaky in Nigeria. So the reason you see them engaging medical doctors, you see them engaging nurses, you see them engaging midwives and the rest, is because of those their licenses. They are taking advantage of their licenses because they know that they have something at stake. They have something to lose. They swore to an oath. And that is why you will see them doing majorly what we social workers are supposed to do. They can only come into the picture when we refer them or link them to those medical professionals in the course of our therapeutic engagements. Like I said earlier, my happiness is we are growing, gradually growing, and we are getting to that stage where we are becoming aware of our responsibility and what is expected of us. So let's do it and network among yourselves. When you go out there, try to see how you can gather more experience and practice professionally. By the time you do all of this, you will see that you will improve in your service delivery. You'll be able to create that awareness, build trust, create a safe space for people to trust you more and leverage and depend on you more for services, right? So going forward, we will now be looking at, I think, I would like us to conclude here, given to our time. Let us quickly take a look at the values and ethical principles of social work. But for today, we'll be looking at the core values. Earlier on, I made mention of the fact that we have some set of values that form the core values of social work. And when we say core, that means something to be at the core, that is the center, the roots, the foundation. Without it, nothing can stand. Yes, these core values embraced by social workers throughout the profession's history, and they are fundamental to social work's unique purpose and perspective. In fact, everything about social work profession is within these 6 core values. And that is why I made mention earlier that if you see yourself practicing and rendering services outside the expanded boundaries of these 6 core values, then you should go back and rethink, because what you're doing is not social work. It has come to the time where, as professionals, we should be able to differentiate between professionals and non-professionals. By virtue of this training, you should be able to identify who is a professional and how you as a professional should practice in a professional way. One of the core values we'll be looking at is service to humanity. There are a lot of services we render. If you belong to a cabal and you're sent to go and rob or kill somebody, you're rendering service. You're rendering services. But are those services to humanity? That's the question. So whatever services you're rendering, it should be that which is geared towards solving societal problem. The society is dynamic. No matter how sophisticated, no matter how technologically advanced we become, there would always be a problem before us. In fact, every new invention, every new development and improvement will bring about problems. And that is what we refer to as social change and social problems. You see that your streets or that your community you find yourself. If the government wants to, Njoku, please mute your mic if you don't want to speak. All right. So that streets you're living or that community you find yourself, if the government wants to introduce any development or maybe any program, you will see that it will lead to some injuries, right? That is social change and social problems. So no matter how good an invention, no matter how good the development is, it will result to some problems. Like here in Enugu, where I find myself, the government of the day is trying to make some rural areas of the metropolitan city to become urban areas. In fact, according to him, he wants to ensure that the whole part of Enugu metropolis becomes urban, and as such, he's trying to expand the roads of Enugu metropolis, especially in the Enugu East part of the city, the town, right? And this has led to a lot of demolition. This is a welcome idea, but it has led to a lot of demolition. Situation where some persons who have been considered to be landlord for the past 50 years, for the past 20 and 30 years, have now been sent back to their villages, or some are now tenants. While that was a welcome development, it has led some to depression. Some have even started having suicidal thoughts. Some have even committed suicide. Some have dropped out of school. Some are poor and now begging in the streets. So whatever services you're rendering must be that which is geared towards humanity, helping the less privileged, the disadvantaged, to come back to their mainstream of social functioning. And of course, you know what it means to render services to humanity. No matter how well-intentioned, how good you're doing, for you go to a community and you're giving people money. Fine, you're rendering services. But the way and manner you're sending those monies, is it fair? Will it promote humanity? Or will it jeopardize the cause of humanity? That is it as a core values when it has to do with service to humanity. What about social justice? Yes, one of the things that is at the center of social work practice is to push for social justice, to challenge repugnant practices, unjust practices, inhumane treatments in the society. No matter how beautiful and well packaged these services might look, we try to challenge them. For example, there is something that is happening lately in the healthcare sector that is looking, or even, will I say, in foster care, that is looking like it is very good. But then, with the social workers' third eye, we are trying to address and arrest the situation. You see, most of these orphanage homes and motherless baby homes, most of them are fraud. People even go there to donate just to ensure that children who find themselves in this shelter have something to eat. But those who are supposed to take charge of these children, to take care of them, oftentimes siphon these things to their houses. And oftentimes, these orphanage homes we see or consider to be orphanage homes themselves are actually baby factories, taking advantage of the poor nature of some persons, some Nigerians, the poverty in Nigeria, to do business. How do they succeed in this? They go to the street sometimes, they see young girls who are pregnant, or try to talk to young girls who can keep up with the deal, right? Or some children, young girls who have been pregnant and they've been sent out from their homes. They will call them, invite them, take good care of them, feed them, take good care of them until they put to bed. And they'll have a deal. In the end, maybe they'll give them 200 or 500,000. That is injustice. That is wickedness. That is inhuman. What about dignity and worth of a person? So as a core value, social work professionals are interested in upholding the dignity and worth of a person. In fact, identifying and upholding the dignity of people in itself can be therapeutic. People that come to assess our services, our clients, oftentimes come with a low self-esteem. Some of them come with a shattered sense of self-worth. They feel they are useless. They feel they are flagabasket. They feel they are nothing. In fact, they should just die. But imagine the social worker helping them to identify a strength within them, helping to empower them, helping them to know how powerful they are, how intelligent they are, and how they can leverage on these qualities to become better and useful to themselves. So the fact that people come to us with low self-esteem does not mean we should look down on them. So while rendering services to them, using the person in environment principle or the strength-based perspective, we dignify our clients by identifying their worth, by letting them know that even though they are weak, even though they are going through a lot, they can be professionals, they can be experts in solving their own problems. So by so doing, it stipulates that as social workers, what we do is to work with clients as experts in solving their own problem, not solving their problems directly. Because solving their problems directly in most cases is a way of going further to harm them or disempower them. We also leverage on the importance of human relationship. We mentioned service to humanity, social justice as the second one, and the third one, dignity and worth of a person. We are now looking at importance of human relationship. There is a saying that if you harm a madman, that is when you will know that that madman has relatives. If you want to know that all the mad people you see in your village or in your town, they come from a particular family, try to attack that madman. So as social workers, we know that humans cannot exist in a vacuum. It is not possible to say, okay, fine, this person or this particular individual came from nowhere. People can be traced to a particular family. People can be traced to a particular community. People can be traced to a particular association, particular culture. People can be traced to a particular religion. And we understand that where people belong to, be it family, culture, religion, communities, can have a bearing, can shape people's worldview, can shape people's mentality. And as such, we take advantage of people's relationship to address their problems. Take, for example, as a social worker that is geared toward taking children off the streets. You wake up one morning on your way to work and you notice a street child, a truant child in the street. And you try to interview. One of the things you will be asking or you will try to want to know about that child. Is this our parents? Where do you come from? Where's your mother? Where's your father? That is because you know that that child did not fall from heaven. So one of the things we take advantage of in our engagement with clients is human relationship. Nobody can exist alone. Even if you decide to go to the forest to sit or to stay all by yourself, there in the forest, you cannot stay alone. You relate and interact with other wild animals in the forest. You will interact with the vegetation. Yes. Even the mosquitoes would also interact with you. In the process, if you're exposed to mosquitoes, you have malaria. And if you have malaria, you will need medicine, whether orthodox or whatever, to treat yourself. So whatever environment you find yourself, it is a human relationship. And as a core values in social work, we identify those relationships. We don't look down on those relationships. We take advantage of those relationships to drive home services to our clients. And the fifth one is integrity. We've been talking about professionalism, we're talking about ethical code and the rest. And I, in most times, pointed to the fact that as social workers, we have the responsibility. Adebi, kindly mute mic. Adebi. Adebi. Thank you. So, As social workers, we have the responsibility to uphold the integrity, the image of the profession. The social work profession is like the last hope for mankind, especially those that are disadvantaged. And for it to get this image or to get to where it is today, it took a lot of sacrifice and endurance, as well as the integrity of practitioners over the years to build this image. So we must continue to practice in a way that will uphold the integrity and create accountability so that service users will continue to trust in the services we render. And finally, we'll be talking about competence. Social work, like other professions, does not have a bus stop. There would never be a time where you would say, there is no need for me to stop learning as a social worker. I was so appeased. I was so pleased. I was so happy when one of you related an experience in the field, and you said you're able to capture the fact that you're still learning in the field. That is what it means to be competent, to have that open-mindedness, to engage in what we refer to as cultural humility, to be humble enough to want to learn the culture of others, especially your client, as you continue to have engagement with new audience, clients from different backgrounds. You must be able to learn about where they come from. You must be able to understand what is expected of you and how to navigate through the hurdles associated with applying the codes, the principles, the values, and the ethics of social work. That makes you a competent social worker. And you might ask, how can I progressively continue to prove that I'm competent? From time to time, there will be workshops. There will be conferences organized from one place and another. Try to see how you can engage in research. Try to see how you can pay to learn, to expand your knowledge. Some of you are into private practice or are into international, working with some of these international NGO. At the end, once you're licensed, you have the ability or you will now be at liberty to see how you can look for conferences outside the country you attend. Earlier on, we talked about professionals being able to network. Expand your network. That is how you'll be able to give yourself opportunity to expand your audience and to your level of intervention, right? And competence can also be measured by how you're quick to make reference or referrals to clients. For example, you have these clients and you are a psychiatric social worker, or let's say you're a medical social worker, and this client has a fracture, and maybe you happen to be a medical social worker in an orthopedic hospital. And what actually brought this client to the hospital is as a result of the accident that led to that fracture. Now, after taking care of the fracture, or in the course of taking care of that fracture, you notice that that client has a mental health issue. Or maybe that accident made the client to develop a mental health issue. Now, as a social worker, you should be competent enough, even though it's not within the line of your specialty, you should be competent enough to identify that, this thing is affecting the mental health of my client. And you should know a psychiatric social worker or an agency within your town, within your city, to immediately refer or link that client to receive services associated with his or her problem. That is what it means for you as a social worker to be competent. So far, so good. We've been able to talk about, we've been able to give, throw light on the definition of social work. We've been able to help to understand what social work is all about, who are social workers, who are professionals, how can we say, or why is it said that social workers are professionals, the meaning of code of ethics, the basic principles and components of ethics, as well as the reason why social workers should be guided by the code of ethics, and finally, the core values of social work. And I want to use this opportunity to let us know that it will be very necessary and it's very important for us to have it at the top of our mind or the tip of our fingers, the core values of social work, and know how it operates or how it works, because it will help us to filter and identify the services we are rendering. It will help us to ask ourselves, to make a self-scrutiny, to know and justify our services if it's in line with the core values of social work. Like I said earlier, if you're practicing, no matter how well your intentions are, if they fall outside the expanded boundaries of the social work values, then what you're doing is not social work. You might be a good Nigerian rendering services. You might be a philanthropist. Fine. But that does not mean what you're doing is social work. So we have gradually exhausted the time allocated for this course. I would briefly allow you to ask questions if you have any, so that we can quickly address those questions and then call it a day. Okay, Azagba. I hope I'm pronouncing the name well.
Yes, sir. So I was giving you an applaud. I was applauding you, sir. Well done, sir. Thank you. You said so
Thank
much.
you.
I'm so enlightened. I'm just happy to be here. Yeah, because I want to be a licensed social worker to do this work. Thank you. All right, sir.
Thank you.
All right,
Thank you.
sir.
You're welcome. You're welcome. All right. In the absence of any further questions, we like to draw the curtain here. And please, since you have the material, it will do us good if you prepare ahead of time. Okay? Let's see how we can prepare ahead of time so that we can make the class an interactive one. I appreciate your comments. I appreciate the questions. I appreciate the input. I want to believe that by next class, if you're able to go through the slides, you'll be able to contribute even more, which will give us opportunity to explain further. Take care and enjoy the rest of your day. Bye.
Bye,
Bye,
sir.
sir.
Thank you.
Thank you, sir.
Thank you, sir.
God bless you, sir.
Bye.
Thank you too.
Thank you. Thank you.
Thank you.
Mrs. Adebute, ẹ kú iṣẹ́ o.